Hey guys, so wanted to take a few minutes to give you what I am hoping will be the last surgery update video I ever have to make. Not that I'm ungrateful, I'm so grateful that I even had the ability to have lower surgery, but at the same time, I'm ready to talk about something else. I'm ready to be doing something else other than recovering. So, just a quick update from last time. My healing took a really long time. I ended up, the source of all my woes ended up being an infection that I had. And it was an infection that I had in my scrotum. And it also, the wound in my penis also had the infection. So that is probably the underlying cause to why I lost a testicle. And it is also the reason why it took ridiculously long for my penis wound to heal. I had that catheter in for 6 weeks. It was miserable. Um, it wouldn't have been that bad had I not had the work schedule I had, but as it is, I was doing those 80-hour weeks I already told you about, and it was really difficult to work those type of hours while I had that catheter in. But I got on my third round of antibiotics in a 6 week period of time, and the infection cleared up. So I am 7 weeks post-op right now, and I'm healed. Everything is working perfectly. Everything's great, and I'm out of pain, and I'm back to all my normal activities. So I'm really happy about that. So that's a quick update on how I'm feeling. The rest of the video, I just want to talk about my general feeling with, and this might get lengthy. I hope it doesn't get so lengthy you stop watching. Um, my general feeling with the surgeries, my lower surgery experience. Would I do anything different? If so, what would I do differently? So overall, I'm really, really happy with my lower surgery. Extremely happy. I there are very few things that I would do differently. Starting off with the first decision I made of what surgery to get, I am very happy that I went with metoidioplasty. For me and what I want from my body and my life, it was the right surgery for me. And especially coming on this side of it, psychologically, how I feel, even with this amount of recovery and these amount of complications, I don't know that I either could have or would have wanted to handle the more complicated, more lengthy recovery of a phalloplasty. It's a great surgery, but it is a longer process, and I don't have anything left in me right now. So I can't imagine being right here and still having more to do. So what I ended up with, I'm extremely happy with. I love my body parts. So I wouldn't change a thing when it came to the surgery that I chose. The next decision I made in the very beginning was, what surgeon should I choose? And I went with Dr. Crane. I explained the reasons I went with Dr. Crane in my first lower surgery video. So all those reasons for choosing him are the same. How do I feel now that I'm on the other side of it? I feel like I made the absolute right decision. One of the big factors for me choosing Dr. Crane was the aesthetics that people come out with on the other side of the surgeries. The aesthetics of my penis are very pleasing to me. It looks like a penis, and it's positioned, part of the positioning was how my anatomy was anyway, but part of the positioning of things are due to the work Dr. Crane does when you're having the surgery. So I'm very pleased with the aesthetics of my penis. My scrotum and my one testicle that I have, I love Dr. Crane's scrotoplasty technique. Many doctors, they just slip the implants into the outer labia and fuse them, but there's still a seam between them, and that wasn't the look that I personally wanted. I love the fact that he fuses them into a single scrotum with two sides for your testicles, and he moves everything up forward so that your scrotum is right below your penis, where it would be if you were a cis male. So I'm really happy with where my scrotum is placed, and even with only having one testicle, because I didn't have a huge amount of real estate to work with when it came to outer labia to begin with, um, just having one testicle still really fills up the scrotum, and the one testicle moved over into a central position. I think it was happy to have the extra room. It moved over into a central position, and I'm really happy with how things ended up looking even with one testicle. So I'm really happy with my surgery results and the surgeon I chose for aesthetic reasons. When it comes to Dr. Crane's skill, I am amazed with how he took what I had and turned it into what I now have. It is amazing to me. Tiff is baffled. You could never tell by looking at me that there was ever female anatomy there. There's no trace of it. It's just completely gone, and it's wonderful. And just as another note when it comes to Dr. Crane, his communication during this entire process has been something that I've really, really valued. I've had experiences with other surgeries, and it's a really frustrating thing when you're having a complication or just a concern, and you can't talk to your surgeon one-on-one, or you can't get a hold of anyone to talk to about it. That hasn't been the case with Dr. Crane. Throughout these two surgeries I've had with him, he has been available 24/7 for me. Of course, I've not been calling him in the middle of the night, but he's always been available via phone, via text, even on the weekends when I've texted him or called him with concerns. It was even Easter, he answered my phone call. And he's always been kind and caring, never acting like my questions were ridiculous or like I was putting him out. He really puts his personal patient care, high on his priority list, and that's really been something that I have valued throughout this entire process, because it's hard to know what to expect and what is okay when you're healing wounds such as these. You don't know what the right thing to do is, and there's a lot of unknowns and fear that can be involved in that. And I really appreciated him being willing to constantly talk with me and communicate with me, reassure me, and guide me on how to take care of myself, especially since post both operations, I had to return home relatively quickly to get back to my company. So that has been a really great experience for me. So I wouldn't change a thing when it came to the surgeon I chose. I would go back to him if I ever had any other needs. And that, even though I'm going to make a different video about my chest, I feel the same way about my chest results. My original chest surgery came out looking terrible, and it didn't improve. And I went back to my original surgeon and got a revision, and it still didn't improve. And some other things went wrong that I'm not going to talk about right now. And Dr. Crane, what he did to my chest is awesome. I mean, yes, I have the scars now, but scars will fade in time. What I had going on was never going to get better. So I'm ecstatic with my chest results. So I can't wait to show you those, but I need to get back in the gym. I've been out of the gym for 10 weeks, and I'm not looking as good as I could. Let's just put it that way. So my surgery type, my surgeon, I wouldn't change a thing. I'm really happy with both of those. And additionally, Katrina at Dr. Crane's office, she was also there 24/7. So that I just had to mention that because she was helpful on many, many occasions for me. Let's see. The things I would change about my surgery experience. The first thing I would have changed is during my first surgery, I just had the normal size catheter put in. I mean, it wasn't a choice I had. That's just, I had the catheter. The catheter was put in that is always put in. My second surgery, I had a smaller size catheter put in, and that made a huge difference for me when it came to being able to function in my day-to-day life while having a catheter in. And I don't know that what I would have done if I didn't have this smaller catheter in this time around, because of having to go back to work and because of having it in for 6 weeks. So I would have liked to have known. I would have liked to have known that catheters could have been such a bad experience, and I would have liked to have known that an option for a smaller one was there. Now, granted, it did take me like 4 or 5 minutes to empty the catheter when I had to pee, which was kind of a pain in the ass. But compared to the discomfort I had from the larger size catheter, I would take that anytime. So that's one change I would make. The only other thing I would change is the timing of this last surgery. In the last year, as in the last 12 months, I had my complete hysterectomy with removal of the ovaries and cervix, and I had my metoidioplasty, urethroplasty, vaginectomy, and scrotoplasty, and then I had this fistula repair and the testicular implants. I was exhausted going into this last surgery. I knew I was exhausted. I knew I was drained. I knew I hadn't recovered, but I went ahead into the surgery because I knew it was going to be another year before I'd have time for a surgery again, and I didn't want to wait. Looking back at it, I can't help but wonder if my inability to deal with my postoperative infection had a lot to do with how drained my body was from so many surgeries in a short amount of time. And it's not like in between surgeries I've been relaxing. I have a job that keeps me very busy. I have a family that keeps me very busy. I refuse to let anything in my life slip because of my transition to surgeries. So I'm just I've been walking dead for a year from physical exhaustion. So I can't help but wonder if I had waited longer for this last surgery, if the results would be different. And I'm only talking about my testicle loss. All my other results are great. So I can't help but wonder about that. Other than that, I wouldn't change a thing. I'm really happy for this lower surgery road to be over. It was hard. It was physically hard and demanding. Psychologically, it was really, really hard. It throws you into a lot of emotions that you're not quite prepared for. You feel helpless. You feel like you have no control. You are stuck for weeks on end in bed where you have nothing to think about but the fear of what could happen and the people you're letting down by not being out of bed. You have the psychological aspect of the relief of finally identifying with your body that releases years of emotions that have been bottled up in years and years of hatred for your body. It's a really emotional time, and it's psychologically demanding, especially if you are in a position like me where you can't just take the time to caretake yourself emotionally and psychologically. There's too many other things going on, so you just have to hold your shit together and then, slowly by slowly deal with those emotions when you have a little bit of time here and there. So just, those are my last words that I have. Advice-wise for all of you looking into lower surgery is be prepared psychologically for difficulties. And I don't mean that in a negative way. I just mean there's a psychological aspect to this that can't be ignored. So this is running 14 minutes long right now. Don't want to lose anybody's attention. So if any of you have any questions, feel free to message me. If they're personal questions, message me. If they're just general questions, you can just comment here. But thank you for everyone who has messaged me and supported me through all of this. I appreciate all of you, and I hope the information that I've given you in documenting this will be of some help to you all. So I wish you all the best, and good luck with your surgeries.